All right, so it's 12 o'clock. Good afternoon, everyone, and welcome to our healthcare impact of healthcare organizations panel, and what the impact that the healthcare organizations have in minority communities. My name is Envida Quinones. I am the president of ALPFA Philadelphia, and I welcome you all today. Thank you for coming. I want to give some welcoming remarks and thank you on behalf of ALPFA Philadelphia. I want to acknowledge our sponsors, AstraZeneca, Merck, and our collaborators, Temple University Health and Collazao Healthcare. Unfortunately, one of our previous panelists, she is not well today, so is not going to be able to join us, Yvonne Rodriguez from AstraZeneca. But we are going to have Paula Obaya. She is a Hispanic BRG lead and clinical learning excellence specialist in the clinical excellence, respiratory immunology, and vaccines. I'm grateful to have you all today. I just want to give you a brief information about Temple Alpha. Let me just share my screen. ALPFA Philadelphia, ALPFA, the national organization, we're the premier professional association dedicated to empowering and developing Latino leaders in every sector of the global economy. We work to connect, inspire the next generation of Latino leaders for purposeful impact in the greater Philadelphia community. We have over 95,000 members national, 25,000 professional chapters in ALPFA Philadelphia, which is hosting this event today. We are our professional regional chapter. With over 150 chapters nationally. So we've been around for over 50 years. Locally, we have over 1,900 members. 75% of our membership is professional members and 25 is about student membership. We are a totally volunteer board. We dedicate our time and energy to develop and execute programming for this community. And we provide programming and events for leadership development, access, recruitment, retention, mentoring, and branding. One of our initiatives is a program called LEAD, Leadership Engagement, Advancement and Development Value Circle. And in that value circle, we are emphasizing professional EQ, wealth creation, health and wellness, community engagement, entrepreneurship, business mastery. This event today falls under health and wellness. So again, thank you all. I appreciate your time and commitment to being here and sharing with our members and friends. And I'm going to turn it over to Dr. Collazao of Collazao Healthcare. Thank you, Dr. Collazao, for being with us today.
All right, let me if I can find my camera, you'll see what I look like. Oops.
We have your cameras on, so you're all set. Joe, can you go ahead and share the slide?
I am Dr. Rafael Collazao. I am the founding member of Collazao Ophthalmology and Optometry Associates, now known as Collazao Healthcare. We're a comprehensive eye care practice, including optometry, ophthalmology, and now podiatry as well. Been working in the Hispanic community in North Philadelphia for 35 years. So have a little bit of experience what it's like to provide healthcare to our people, to our community. I'm going to introduce or ask two individuals to introduce themselves. I am humble to ask them to introduce themselves. I've looked at the resume and these individuals are amazing. So I'm going to ask Carmen Villar of Merck and Paulo Valle is going to talk about Yvonne Rodriguez from AstraZeneca as well. So ladies, can you please introduce yourselves? Carmen?
Sure. Hi, everyone. And thanks to Alpha and everyone on this call for having me today. My name is Carmen Villar, and I work at Merck. I'm a vice president for something we call social business innovation. But it's really looking at how we can both increase social impact and business impact together. We do a lot of work with communities. We run big initiatives like Merck for Mothers, and we also run a Merck Foundation and some charitable giving programs. I can talk much more about it as we go through the panel, but just wanted to say that I am a longtime veteran of government service and worked at the Centers for Disease Control and Prevention for a long time. And then I switched over to Merck about 4 years ago. I'm getting a note that I'm supposed to hand over to Dr. Vega. Is that right, Varga?
Yes.
Okay. Sorry about that. We'll
Yes.
continue in just a little bit.
Thank you. Thank you. I apologize. Let me please introduce Dr. Vega. Thank you, Dr. Vega, for joining us, and she's going to do a keynote.
Of course. Thank you, Adita. And thank you, Alpha, for the opportunity to share my story and also to tell you what I think about this important topic. So I'm going to tell you a little bit about myself first and the journey and why I think it's important to touch upon these health disparities. So I was born and raised in Ecuador in South America. And when I was in high school, I met a physician who belonged to the NGO Doctors Without Borders. So I love to travel and to learn about different cultures, and this was a great opportunity to do that. So I started medical school in Ecuador, and then I moved to the United States in 2005 to continue my career in pulmonary critical care and sleep medicine. And as I advanced in my training and career, I realized that I didn't need to travel the world to help patients. I was needed here in the United States, a country that probably has the best medicine in the world, but not everyone has equal access to high quality care. And this is why I think we are talking about this topic today. And I think as a physician, we want to help our patients to live their best lives. And healthcare disparities are not new. They've been documented for many years, but they have been exacerbated by the COVID-19 pandemic, which disproportionately affected minorities. So research demonstrates that minorities are less likely to receive preventive medical treatment, and they also receive lower quality of care. In spite of advances in treatment and diagnosis of chronic diseases, there is evidence that minorities experience greater mortality and morbidity compared to non-minorities. And it's interesting that these disparities in healthcare are not access-related due to access-related factors, because only about 20% of our health is affected by the healthcare system. And a bigger component comes from other determinants of health, such as social, environmental, economic, and structural. So the way I see this, there are two ways to approach this problem, one at the individual level, and the other one is at a larger scale. So policy development, whether at the federal, local, state level, is critical to end health disparities, because small organizations and individuals are not able to change big public health issues, but we can certainly be our patients' advocates and voices. So this is why I think diverse representation in our workforce is important. Studies have shown that diversity in healthcare improves patients' outcomes and patients' care. So we need to increase the number of minority physicians in the workforce and our institutions, and also to reflect the diversity of the US population. If you don't have representation in these institutions, there will be no understanding of the problems that are affecting the communities. And for me, I think that reaching the diagnosis and implementing a treatment plan is not difficult. I think that the biggest challenge when taking care of patients is addressing all the other determinants of health, especially when you take care of patients who are from minority communities and underserved populations. So I'm going to give you a couple of examples, two patients. One of my patients a patient comes to the office, she can't sleep. I diagnosed her with insomnia, and I reached the conclusion that her insomnia is related to PTSD, so post-traumatic stress disorder, from an assault that she had a couple of years ago. So as a result of that, she has anxiety, she has depression, obviously insomnia, so she can't sleep at night. And she lives in a very violent environment and neighborhood. So I know that what I need to do for her is to refer her to a psychiatrist, to prescribe medications probably for anxiety, depression. And I also would recommend for her to move from this violent environment. Unfortunately, I cannot do anything to provide her with secure housing. And nowadays, mental health is not covered by many insurance companies. So this is also a new crisis. And I want to take this opportunity to bring this up because I think this needs to be addressed also as a public health emergency, just like we have done it with the opioid crisis. Lack of mental health care is a problem nowadays. So going back to my patient, unfortunately, there are many things I cannot do for her. I can probably prescribe medication for her insomnia, but she's getting suboptimal care because of things that I cannot control. Another example is my patient with obesity who has obstructive sleep apnea, has diabetes, two diseases that are exacerbated by obesity. So we go over the treatment plan. He knows he needs to lose weight. We go over a nutritional plan, an exercise plan. And then he goes back to his community. So he lives in a neighborhood where they don't have stores that sell fresh produce. He's working 2 jobs. There are no parks where he can exercise or walk or bike in his neighborhood. And he has 5 children and 2 jobs. So for him, it is easier to buy 5 burgers and French fries for his family at McDonald's than to purchase chicken, fish, vegetables, and fruit in the market. And he can't exercise, and he doesn't have time to cook. So this is where I think that engagement and intervention from local, national, and also local and state government is important. Without their help, I don't think we'll be able to achieve health equity. But I think there's still a lot we can do from as physicians at an individual level. Our job is to improve the health literacy of our patients, but the best way to do this is to improve our communication with them. And the best way to do this is by incorporating cultural factors into our conversation. And this is where the concept of cultural fluency or competency come in place. So we need to be able to communicate with different communities and understand how culture influence health behaviors. So for instance, you should not recommend your Hasidic Jewish patient to eat pork as a source of protein, right? So education is key. We need to educate our patients, but we also need to educate our clinicians. And I love my job. I'm really fortunate because I have the privilege to take care of patients, but I also have the privilege to educate the next generation of clinicians. And I try to bring these issues of health disparities whenever I see fit. So some of my trainees tend to label patients as non-compliant. And I always ask them, tell me why the patient is not compliant. Tell me why the patient is not taking the medication. Why is he being readmitted multiple times? Why are they not showing up for their appointments? And I can tell you that most of the time, it's not because they don't want to. Most of the time, it's because lack of transportation. They don't know what medications they're supposed to take. They can't afford their medications. They have mental health issues that have not been addressed, or they're homeless, right? So I think this is why addressing disparities is important, because first of all, it's the right thing to do from a social justice standpoint, but it's also because it will improve the overall health of our nation. And a healthy nation is a prosperous nation. And this nation was founded under the concept of equality. It is in the Constitution. And I'm gonna leave you and share one of my favorite quotes from Ruth Bader Ginsburg, who's my hero. She said, "I didn't change the Constitution. The equality principle was there from the start. I just was an advocate for seeing its full realization." So I'll leave you with that, and thank you again for the opportunity to talk about this topic.
All right. Thank you, Dr. Vega. Let's begin the, what is going to be a casual discussion. In any organization, you have individuals who are considered influencers. These individuals can single-handedly sometimes change the discourse on how an organization tackles a specific issue in order to improve the outcomes. And the issue today, part of the issue today that we're going to discuss is how to close the gap in minority healthcare disparities. And we have three amazing influencers. So I'm going to start by asking each one the question, what does it feel like to be an influencer within your organization and probably in life? So I'm going to start with Ms. Villar. Carmen.
Okay, thank you, Dr. Collazo. And I appreciate, again, just to thank Alpha and everybody for having me here today. I'm not sure, influencer is a strong word, but I think it's probably true to a certain degree. In my company now, I am one of the highest ranking Latinas in the company. I try to actually open my door as much as I can to provide both guidance and mentorship to people who are looking for it. And I really do think that it's something that Dr. Vega said resonated with me about diversity in healthcare improving health outcomes. I would say also that diversity in the workforce also participates in those improved health outcomes, because we are able to influence and guide the company operations from the inside out. We are able to share some of our stories to help people understand exactly what our communities may be going through, or our families may be going through, or perhaps stories that affected our own personal stories, our own healthcare as we were growing up, or growing into the positions that we now have attained. So I think that's a really important piece of being part of a large company, of being a quote unquote influencer. And hopefully it won't be necessarily an influencer position in the future. Hopefully it'll be a position just like the gentleman sitting next to me, or you know, the other person sitting on my other side, that my story will be the norm. It'll be just as important as anybody else's story. But right now, what I really need to do is share that insight, help people understand that improvement in healthcare starts with a relationship, that trust is so important to get patients to understand why we're trying to help them and what that intervention might be that we're trying to offer to them so that they can be healthier, so that they can be more productive members of society and of community. I take that responsibility very seriously. I try to challenge it where I can. It is a workplace, so sometimes you have to be a little bit cautious about that, obviously. But I, within my own small organization of a large company, had the opportunity to reorganize my team. And when we did that about 1.5 years ago, we added a team specifically to try to address issues around health equity and how we work across the enterprise in all of our product areas, in all of our disease target areas, on equitable access to healthcare and to our products, to healthcare interventions that are so important. And in doing that, it's the same, a little bit similar to delivery in healthcare, right? I have to establish trust and relationships within my company so that they listen to what I have to say and so that they understand why what we're trying to do is so important. Only then will we be able to affect that change that we want to make and to have on the patients that Dr. Vega so eloquently spoke about. We want to get rid of food deserts. We want to make exercise easier. We want people to have a living wage, all these social determinants of health. We want to improve those things because, again, as she said, only 20% of our healthcare outcomes are influenced by healthcare, right? The rest are all these other things that we have to do and that we have to deal with. And the more that we can help people inside our companies understand that, the more that we can then have the impact on the patients and the folks who really, truly benefit from what we have to offer. So I talked a lot. I'll stop there, Dr. Collazao, and let the next person give their story.
I am so happy that you did. Paula Obaya, I'm going to go next to you.
Perfect. Thank you, Dr. Collazao. So I wanted to introduce myself really quick. My name is Paula Obaya. I am the lead for the Hispanic BRG group for AstraZeneca. Also clinical learning specialist in the commercial learning training department. So as far as being an influencer, I see it as being a voice for our community, both within our company, AstraZeneca, and also for the patients that we impact every day. I'm here representing Yvonne Rodriguez. But for this question, I'll go ahead and answer from my perspective, since I have the honor of being here with you. So for me, being an influencer, like I mentioned, is just being that voice. Especially within our community, just bringing awareness of the diversity, even within the Hispanic and Latino community. We are all very different. Bringing part education. How can we educate our patients, through patient education, clinical trial diversity, making sure that, the way that we address and how we reach our patients every day will resonate with them. Coming from a predominantly Spanish-speaking area here in South Texas, being raised by a Mexican mother, being Spanish as my first language, I understand the needs of the Hispanic and Latino community, just like Carmen and Dr. Vega mentioned, bringing education, bringing understanding, in their language is so important, and building trust with the Hispanic and Latino community. So that is my goal, is to be that voice for the Hispanic community within AstraZeneca, to educate and to bring value.
Thank you, Ms. Obaya. Dr. Vega Sanchez.
Thank you, Dr. Collazao. So when you say influencer, I just feel like it's a 20, 30, 40-year-old, like the younger people. I'm not that young, but thank you for that. But anyway, the way I see my position, I think I'm I feel like I have a huge advantage, because when I'm treating my patients, my Hispanic patients, because I speak the language, I know the culture. So I think that for me, it's easier to treat Hispanic patients, but I know that other physicians within my institution make every effort to do the same. They learn a few, words in Spanish. They try to connect with our patients. But I think that my role is kind of unique in the sense that I'm able to treat patients. So I'm able, hopefully, to help with health equity by treating patients. And at the same time, I always try to also improve the diversity of my institution and the workforce, because I am the program director of the program of the Pulmonary and Critical Care Fellowship here. So I always try to recruit trainees and also faculty members from minority backgrounds, because I think that it's important. So we can improve health equity, basically. And like I said before, educating our younger generations about the health disparities and why it's important to address them.
Thank you.
How
all
about
three
you,
of
Dr. Collazao? How are you an influencer?
Well, I will be very surprised if the three of you are not the first Hispanics in the positions that you're in. Am I right? So let me tell you something. I am so impressed of listening to the three of you that if history would repeat itself and had to choose an individual to be in those positions right now, I hope it would be you again. The eloquence is amazing. I'm humble. Me an influencer. Well, it's amazing in this day and age to inspire trust in people. And Dr. Vega will know more what I'm talking about when you can feel that the patient you're talking to is a Hispanic patient, and not only are you talking to them linguistically, you're talking to them culturally, and it inspires trust. And to have trust from someone is power. To have blind trust is amazing. And as you see in the cartoons, with power comes responsibility. So it's humbling to have that kind of responsibility, and it's a power that you feel that you have to do right. And I can see three individuals who feel the same way that I do, that whenever we are in a position where we can influence something, we do it for the right reasons. And at the end of the day, it feels good to be able to accomplish that. All right, moving along.
Thank you.
I had some trouble understanding this concept, so I had to go to Dr. Google and get a second opinion. But I'm going to difference between health equality and health equity for the sake of those who are listening to us. And this is the example that I like. A pharmaceutical company comes in with a new product. I'm going to call it Tylenol. And they place Tylenol in the market. And they price it, and anybody can get Tylenol. Well, that's an issue of health equality. However, some people can buy a lot of Tylenol. Some people can simply buy Tylenol. Some people cannot afford Tylenol. That's an issue of health equity. And that's what we're going to be dealing with mostly today. I want to ask each one of you, how does your organization define health equity? So, Carmen, can I go to you first?
Sure. I don't think I need to define it any better than you did, Dr. Collazao, but really I think about, there's the cartoon or the slide that some of you may have seen where there's a few kids, like 3 kids standing, and they're trying to look over the fence to watch the baseball game, right? And one is short and one can see, one is tall, and then the other one is kind of can see a little bit, and then the next picture shows the kids where they have the same size blocks, so they can see over the fence, right? What I really want to think about when I think about health equity is where there's no fence, where everybody can see and everybody has the same access to that great game, right? Or to that same health care, or to that same Tylenol. And that's really how we try to think about it at Merck. I will say that the company has a deep history of really trying to support communities to achieve health equity. We have this longest running public-private partnership that I've ever experienced in terms of our Mectizan donation program, where we're trying to eliminate river blindness and elephantitis around the world. And we started as a vaccine company, which was really designed to help people, you know, a prevention kind of stance. So when I think about the DNA of our company, it is really founded in this idea of health equity. But we really try to target areas where we can make a meaningful, measurable, and lasting impact, getting rid of those fences, getting rid of those barriers to health. But we also want to tackle non-health factors like we were talking about before, like systemic racism, climate change. It was really interesting. There's this whole, there's a movie, a short film, and a whole movement happening in Newark, New Jersey, here not far from where I live personally. And it's about the air pollution and some of the incineration and other things that are happening in Newark. And while people, a lot of underserved folks lived in these communities around these incinerators, and it's causing, you know, horrible health impacts. So we don't often, I know those of us in the field, we think about climate change and how it affects our health, but lots of times people don't put those two together, that this is an underlying inequity, that people often live in, people with poor health often lived in communities that have poor quality of their air, the air that they breathe every day as well. So we really try to address some of these bigger systemic issues. And we make our health equity commitments through our ESG goals, our environmental, social, and government goals, to expand access to health, which is one of our big 4 ESG pillars. We really strive to reach more and more people through our programs, not only in the US, but across low and middle income countries. We have some goals that are very public in our ESG report about reaching over 30 million people across the globe and enable 100 more million people to access our innovative portfolio of healthcare. But we really are looking at access to quality care, things like digital inclusivity. When I travel to other countries, you often, you know, you'll see people using their cell phone for everything. Now, we use our cell phone for a lot of things in the US, but I don't think we take full advantage of it, right? And getting some basic medical questions asked. There are some communities around the world that are prescribing, that the physicians are doing the consultation, prescribing the meds, and then delivering it within 2 hours to the patient, you know, in their community. So thinking about digital inclusivity, health literacy, economic inclusion, but innovation beyond, because what we've been doing has not been working, right? We are seeing and dealing with some of the same challenges. So how can we change the industry to think about doing things in a more innovative way? How can we get things like mental health not only covered, but acknowledged and discussed as a huge piece of the healthcare system and the healthcare challenges we're all facing today? So this is how we think about it a little bit at our company, and I'd love to hear from the others.
All right. Paolo Valle, how does your organization define health equity, and how are you tackling the issue?
Thank you, Dr. Collazao. So at AstraZeneca, our commitment is just to ensure that all patients have that opportunity, just like we all mentioned, to receive that right treatment at the right time to improve health outcomes. You know, making sure that right treatment is in the hands of the patients that we touch every day. So, you know, part of this commitment to patients is we have an Act on Health Equity initiative. And then just this initiative works just to bring that health equity front and center to all aspects of our business. So this advisory council just brings together just distinguished groups of people, both external and internal, from the public and the private sector. And, you know, they help to create and find opportunities for that equity for our patients. One of the things that I'm going to be speaking to today is that clinical trial diversity. So our goal is that by 2025, that our clinical trial participants are going to mirror those characteristics of the disease populations that we're treating every day. So clinical trial diversity efforts are embedded in every part of our enterprise, led by clinical engagement and policy. Another area that we really strive for that health equity is just through the various programs that we have. We know access to healthcare is difficult. Access to medicines is difficult. Just like many pharmaceutical companies, our goal is to enable our patients to have access to those medications. So a lot of programs for medications, clinical trial diversity, education in Spanish, which is so important. So those are some of the things that our company is doing around health equity.
Thank you for your answer, Dr. Vega Sanchez.
So I think that at Temple, we strive for the highest possible standards of care for all. And we give special attention to those who are probably at risk, a greater risk of having poor outcome, especially given their social situation. And there are many efforts at Temple, and I was surprised when I first came here years ago. There was, and there still is, a floor where Spanish-speaking patients are admitted to, and all the nurses speak Spanish, everybody speaks Spanish. You have signs in Spanish, everywhere is Spanish and English. You have health navigators also. So I think our organization tries the best way it can to try to help minorities because that's the patient population that we serve.
Thank you for your answer. Different question. How important and what type of partnership models are critical in order to advance a sustainable and impactful approach to addressing health equity? Carmen, can you talk to that?
Sure. First of all, I think it's obvious, as you can tell from the diversity of this panel, that we can't do it by ourselves, any one entity, not the healthcare provider, not the private pharmaceutical company, not the community-based organization or government. We all have to work together actually to try to solve some of these problems. If they're systemic in nature, we have to work with the people that control the systems, right? Or create the systems. If they're scientific in nature, we have to work with the scientific community, whether that be at universities or in hospitals or in pharmaceutical companies. So I think this is a challenge that we all need to step up to. And I know it's hard because we get caught up in our day-to-day so often, but making an effort to really think about, for example, the pharmaceutical industry. How do we come together with the resources and the intellect and everything that we have to offer as a company? If we just came together and did that to try to overcome some of the health inequity challenges, how much better could we be? How much more effective could we be? And I think, we're talking about some of that now, and we work through our industry associations to try to do that. I think, we have traditionally partnered with a lot of non-governmental organizations. We do, as I said, have a foundation. So we work, for example, with the American Cancer Society. We have a return to screening effort after COVID, really trying to make sure that people are getting the screenings and the tests that they need, getting back into care so that we can reduce the cancer screening disparities. And preventing later stage diagnosis. We find a lot, especially in Latino communities, that people tend to wait to get screened or to go to the doctor at all, as I'm sure you've experienced in your day-to-day. So they come in later and they come in sicker. And we are trying to really take this opportunity to partner with folks like ACS and around the world to get people back into care. And I know that's even more of a challenge in the Latino communities because we weren't necessarily up there at the front of the line in the first place. But we're also working with the City Cancer Foundation, City Cancer Challenge Foundation, and that's a global institution around more equitable outcomes for women with breast and cervical cancers, because we know that, again, women of color are more adversely impacted by some of these cancers. We're working, for example, on vaccination projects. In Chicago, we have an immunity, it's called Immunity, so Unity Project, to help build vaccine confidence and encourage the uptake again of routine vaccines and those recommended for children. You know, some babies have been born during this pandemic and haven't really received adequate or regular health care. So how do we make sure that they're getting everything they need to live the best lives possible and get ready for school and so forth? And we're also pursuing lots of interesting new partnerships. I think if anything we have learned going through the last few years is that it's going to take all of us, and that might look different than what we were used to prior to 2020. So we're working with folks like Black Health Matters, the Lazarus Cancer Foundation, to recruit and engage clinical trial participants. And we heard this a little bit from Paula, really thinking about diversity in clinical trials. We have a partnership with the National Medical Fellowships, which is a nonprofit organization that gives scholarships to Black and Brown medical students. So we're working with them and have developed with them a course for clinical trials training for physicians who are maybe interested in getting more involved in research, because we have this, you know, hypothesis that if we have more providers involved in clinical research, then we will hopefully get more patients involved in clinical research, so we don't see adverse outcomes on different kinds of communities when drugs are administered. This is really important. I personally have lived through a situation with my mother who was not able to take the recommended dose of medications, and we had to go through over a year of trying to titrate her meds just to get them right, so she could actually physically process and get the benefits of these drugs. So diversity in clinical trials is a key aspect of what we're trying to do as well. And partnering with other folks on innovative ideas and ways to do that is really important for us.
Thank you, Carmen. Paula, can you expand a little bit on the clinical trial initiative that you mentioned before? I have some curiosity about that.
Yeah, definitely. So again, I'll speak as third person. Unfortunately, Yvonne was not able to be here with us. She was the one that was deeply involved with her team as far as clinical trials. So as I mentioned, you know, one of the goals that AstraZeneca has is for that clinical trial diversity, again, for the population in our clinical trials to reflect the populations that we serve in our different therapeutic areas. So, you know, as part of the clinical trials, Yvonne was involved it was called the Paraxel Academy. So what this Paraxel Academy did, it just focused on training physicians and their nurses and their coordinators to just be successful.
Okay.
Times certain clinical trials were only in certain areas. So this just allowed for us to go into communities that were not represented as much through educating physicians.
Great. Thank you, Paula. The next question, I guess it would be more directed to Dr. Vega and to myself, is what are the critical challenges at the community level to improve healthcare equality? Dr. Vega, I'm sure you, like me, have a mouthful about this one. Can you start?
Yes, no, absolutely. And I think you're right. I mean, there are many challenges. I think one of the biggest challenge is language barrier, right? So I think that is extremely difficult for our patients. There's a lot that is lost in translation. And even if you have translators in-house, translators over the phone, there's still a lot of things that are missed in translation. Just like you said, we know the culture, so it's easier for us to understand a lot of things about our patients when we're taking care of them. And like you said earlier, it is a big responsibility because they really trust you fully, 100%. So it is a big responsibility. Another challenge that I see with minority populations is mistrust. They don't trust the healthcare system, and that is historically. And research has shown us that Hispanics and Black Americans are less likely to trust their doctors than white patients. So I think it's really important to strengthen the patient-provider relationships. And I think you talked about this, Dr. Collazao, and it's absolutely true. And another challenge, I think, is lack of engagement from patients. And some of the things we can do to improve that is to reach out to community leaders, because they know the needs of the community. So it's easier to communicate with patients through the leaders. But it's also a way to overcome this is how, the way we all talked about this, health literacy, right? So how can we educate our patients so that they're more engaged in their care? If you know why you're given a medication, you're more likely to take it, right? So I'm going to give you an example of my dad. So my dad lives in Ecuador, and he's an educated person, but as a Hispanic, he just doesn't comprehend the concept of a chronic disease, right? So he was diagnosed with hypertension, and he was given a medication to treat his high blood pressure, and he took it for a month. And then he goes back to the doctor, and the doctor told him, but why aren't you taking the medication? Your blood pressure is elevated. So he's like extremely reluctant about taking the medication. So he talks to me and he's like, well, why do I have to take this medication? I'm like, well, because hypertension is a chronic disease. You'll have this for the rest of your life. So you have to take the medication. So again, education and culture, you have to know your audience, right? So I think those are some of the main challenges that I see. And Dr. Collazao, can you share your experience?
Yes, actually, I'll use an example that encompasses all the health equality issues, all the health equity issues, and any other issues that you can think of in the Hispanic community. 4 o'clock in the afternoon, lady comes in with what is called a glaucoma attack. Lady's going blind by the hour. Don't have much time to deal with here. Of course, she has no insurance. I know that if I send her to where I need to send her, and she gets there after 5 o'clock, she has to go to the emergency room, thousands of dollars that she's going to incur. So I tell her, you have to get on the car and get to this place before 5 o'clock. She says, I don't have any transportation. Okay, talk about social determinants of health. So I have to get on the car, put her in my car, drive her over there, spend 4 hours with her while she gets treatment, and then take her home. Which is fine. This is why we do what we do. This is the vocation. But when you deal with someone who has no insurance, you have to deal with the economics of it, the access of healthcare of it. So who do you refer to that is not gonna charge her an arm and a leg, so for what she has to be done? So you have to ask for favors. So this brings into question, what can we do to try to bring the cost of healthcare down, to be able to deal with these individuals who don't even get to you first because they know that it's going to cost them money. So they'd rather stay at home and get sicker because they're afraid, and they don't know that they can get somewhere who's bilingual and bicultural who can probably help them with that. So it's a big communication issue, which is probably one of the biggest challenges that I see. All right, seems like we're running a little bit out of time, so I'm going to use the last one to say, what is your call to action? How can, within your organization, how can you improve, or what should improve to make things better? So Carmen, once again, I'm going to start with you.
Wow. Okay. A call to action. I think we have to walk the talk. let me say that. We have to do what we're going to say we're going to do. When we say that we're investing in access for patients, then we have to really try hard in that space. We have to do something that makes sense. We have lots of access programs. We have, you know, like patient assistance programs where based on how much people make, they can apply and get drugs, some of the drugs they need for free. We have co-pay assistance, so they can pay for some of it, but they can't pay for all of it. But we need not only to help people understand that they can get access to those kinds of programs, we have to do more. We have to listen. We have to get into communities and understand and create those long-term relationships that are going to create that trust so that people can tell us really what they need. And then we have to respond to that. So there's a lot in there, but I think the listening, trusting, and then taking action on those things that we've heard from those trusted relationships is really critical. If we don't do that, we're just developing products in the healthcare in a vacuum. The patient, right, should be at the center of what we're doing. And we have to listen to them in order to figure out what we need to do.
All right, thank you, Carmen. Paula?
Thank you. So for us, I say we have to continue with our passion and our goal of just connecting with community leaders, academics, healthcare professionals, nonprofit organizations, just to really uncover the need, that need that we all know, and maybe even other needs that we haven't uncovered to satisfy, you know, the needs of our community, of all minority communities, having that cultural competence, that language access, as you mentioned, then also just that health literacy, which is so important for minority communities. And then as individuals within the organization, like I mentioned, I'm the lead for the Hispanic Business Resource Group. We have many resource groups within our company, and each resource group is dedicated, you know, to those communities that they represent. So as individuals, we need to act as well to support, you know, the company's initiatives, to support our communities, and be the voice, again, as I mentioned, for the communities that we understand, that we grew up in, that we believe in, that we have so much passion for. And that we know what the needs are. So be the voice for them, and then just continue in the efforts within our company.
Thank you, Paula. Dr. Vega Sanchez?
Yeah, so for me, my call for action is a more diverse representation because that leads to more equitable outcomes. So I like the quote from Gandhi, be the change that you want to see. That's my call for action.
All right, thank you. Actually, I'm going to go back to the health equity issue. And I want to ask a question of each one of you. Can you give me an example of any obstacles that you have encountered in tackling this issue, either by your organization or within your organization, as well as a success story regarding this the issue of health equity? Carmen?
Yeah, so I mentioned briefly, I think during the introduction, around our Merck for Mothers program. And, you know, 10 years ago, the company looked around to say, how could we help basically deal with some of the inequities we're seeing in healthcare? One of them was this issue around maternal mortality. And we have heard a lot about this recently in the news as well, related to the pandemic. And I think mothers not getting access to the care that they the perinatal care that they necessarily needed. But we established in 2011 a program to try to reach out to moms and try to figure out how we could improve you know, their healthcare outcomes. How could we prevent maternal mortality? Since then, we've, you know, partnered with various organizations around the world, and we've reached over 13 million women in over 50 countries. We further, you know, we re-upped our commitment at the end of last year for another $150 million for over the next 5 years for Merck for Mothers. I think so that's how we're trying to help to address a healthcare challenge. In doing this work, one of the issues that we've come up against and that we continue to try to work with folks to figure out is sometimes the absorptive capacity of our nonprofit partners on the ground is overwhelmed. And I think right now, during this time of what's happened with COVID and in social justice and so forth, we're seeing some of that as well, which is how do we continue to help smaller organizations, community-based organizations, nonprofits that work often within the communities that we work through. How do we make them more sustainable organizations? How do we help them create the capacity that they need to do the work that we all need and what we all see them doing? And so I think this is one of the challenges. How do we provide that technical assistance on the ground so that community-based organizations can continue to thrive and continue to provide the important services that we all know they do?
Thank you, Carmen. Paula?
Thank you. So, excuse me, one thing that Yvonne shared around the clinical trial diversity project that she worked on, the initiative, was, just finding champions, both within our organization and out in the community. So I think that's one of the important things that, no matter what initiative, what goal, what vision we have, it's always finding the right people that have that passion, that vision to make a difference. So that's one of the obstacles that she mentioned for the clinical trial diversity. But she said that, once that was established, they've been able to successfully implement, the Paraxel Academy. So she did share that the success story that she has around this initiative is that they started off small, just trying to train 25 to 50 physicians. And, they started in Mexico and now US inclusive of Puerto Rico, and now it's taken off. So now other countries are now wanting to, do the same for physicians in their underserved populations. So starting out small, finding champions, finding passionate, dedicated people. But once you have that, once you ignite that flame, that fire, hopefully it'll just continue spreading.
Thank you, Paula. Dr. Vega.
Yeah, so interesting to hear from, pharma here, because I can share a story. I've been at Temple for many years, a resident, a fellow. And I remember that as a fellow, we had a clinical trial. And we always have excluded non-English speakers, unfortunately. And I remember being given the task to enroll a Hispanic patient, a Spanish-speaking only patient. And I was given the task to translate the consent form, a 20 pages from English to Spanish. And I had to do it like in a day, like that was so easy. So that was a few years ago, about 10 years ago. So I'm happy to say that probably because of all the efforts that pharma has done, people like you, Paula and Carmen, have done, now we are able to enroll Hispanics into our clinical trials, which I think it's great. So it's interesting, if you are long enough in medicine, you see these changes, and I think these are really positive changes. So I can see it from this side of things, and I know that there's a lot that is being done behind the scenes. So I think that is great. That is one of the success stories. The other one is at Temple, we have a major transplant, lung transplant center. And I remember when I first started my residency and then fellowship here, I didn't see Hispanics getting lung transplant because of multiple reasons. But now I see it. I think that if you need to be evaluated for lung transplant, being a non-English speaker is not a barrier anymore. So I think these are really good success stories that I can share with you.
Yeah, can I
Yes, sir.
comment? Can I just make a comment, Dr. Grasso, on what Dr. Vega said? So Paula has been talking a lot about health literacy. I mentioned it previously also. I think this is such an interesting point for me, because not only is the language important, what language is it in, but the words that we use as we're talking about in health literacy. And I mentioned in my intro, for a long time I worked at CDC, where we help to promulgate guidelines and policies and so forth that would help enact better health literate tools, right? And then I come to pharma, and that's also a huge part of the work that we're doing. We have a person who does that. We have contractors that will review materials and sort of put them through the health literacy guidelines and so forth that at CDC we were developing. And then now what's happening is this push for sort of digital access to information, which I think in the US is still going to take a while to come. But in other countries, we're seeing we're using things like blockchain technology. We can have electronic leaflets so that patients can access that information, which I think is going to be a game changer. But it also has to be health literate, right? We have to make sure that it's not just 20 pages translated onto your phone, that it actually makes sense. It uses some pictures, you know, it's gone through that health literacy guidance. But anyway, I just wanted to mention that because I think it's fascinating to think about how patients might have better access to some of these things in the future on their own little phones and so forth, and that would save a lot of us a lot of work. I'm hoping.
Excellent. In fact, I'm going to use that as a segue because sometimes, as a public, pharmaceuticals company get a bad rap about prices of medication and so on and so on. Sometimes is true, but most of the time it's not. And what the public doesn't see is what else is happening around them. And both you, Carmen, and you, Paula, to a degree, have a lot to do with this. Drug rep comes in to my office with a new medication, and already I'm saying to myself, you know, too expensive, my patients cannot afford it, and so on and so on. But then happened the first time, the drug rep pulls out a coupon and says, no, people who don't have insurance, here's a coupon with a whatever percentage discount to make it more affordable to the patient. I said, great. Not only that, but he pulls out a coupon in Spanish. I said, oh, wait a second. Now pharma is paying attention to my community and making sure that my patients understand what do they need to do to get access to this medication. And now I know that the two of you have something to do with this. So that to me is a success story. I mean, we are getting somewhere. However, we still have an issue, and they're not represented here, so I'm going to be nice to them, is the insurance companies. Because when that same drug rep comes in, I wait until they finish the presentation, and I say, great, are these two insurances, do these two insurances cover that medication? They say, why those two insurances? Because that's 80% of my practice. So, you know, if it's not covered by this insurance, if you haven't done your homework and find out what insurance company is covered this medication, you know, you can have a problem accessing that population. So that communication is starting to take place at the ground level. The other issue is that whenever pharmaceutical companies are on the table negotiating with insurance companies, from the insurance company perspective, it's an economic issue. How expensive is it? Can I cover it? Yes or no? And what they don't know, and we always trying to, I'm sure Dr. Vega and I is doing the same thing, trying to let them know is that, guys, you know, it takes me 3 generic medications to try to do what this brand medication is, you know, can do in one shot. So you're ending up spending more money on the generic type than if you would simply cover this medication. So how about talking to the ground, the doctors who are on the ground first to see, you know, what would be the benefits of having this medication on the market, and see if you can approach it and pay for it that way rather than just pure economics. So Any
I think
comments on
the
that?
insurance companies should hire you, Dr. Collazao, as a consultant to help them understand some of these issues. But no, I think it is, you know, I just will comment quickly on some of the things you said in terms of pricing. You know, I didn't understand this until 4 years ago when I joined a pharmaceutical company, which is some of the medicines we produce take so long and require so much in the research up front, but in the manufacturing and the retooling of factories and so forth to process, to make those medications. And then in the distribution, we have one vaccine in particular that can take up to 4 years from the molecule to the shot in the arm, 4 years to develop, to get into the vial and to get it delivered and out to the patient. That costs money. And that takes time, and it takes innovation, and it takes scientific expertise and manufacturing expertise and so forth and so on. And I think that some of those things, I mean, they were very much underappreciated by me before I joined the company. And so I think there is a level of basic education around what it takes to bring these innovations to patients that's really needed. And I think this issue also about insurance, you know, the average person has so much on their mind already, how they're going to take care of their families, how they're going to, you know, get that job, how they're going to, you know, put a roof over their head, et cetera, et cetera. And I think that it's just really hard to comprehend all of these various pieces of the system, right? So the insurance and so forth. And I think that requires a deeper dive. But it is important that I think people understand that a little bit more, because then you get into these challenges of, you know, they can't get access to the meds they need. The healthcare providers, I know my providers, sometimes I see them get frustrated just like you, because they're fighting an uphill battle to get the right things or the right procedures to the patients who need them. So I don't have an answer, but I do think that a basic level of understanding from patients is really important. And then we have done a lot of work, especially in the cancer care arena, around patient navigators, and really having, whether they're community healthcare workers, or they're lay people that have learned how to navigate the system and can help people and patients do that. We find that, I mean, again, in my own personal case with my parents, as they get older and the healthcare that's required there, you know, my mother, who was a teacher for many, many years, well-educated, you know, all of that, getting her to navigate the healthcare system, the insurance, what's allowed, what facility she has to go to, why that one, why this doctor, all of that. And I said, Mom, you have a healthcare navigator to access. Let's call her together and let's figure this out, because it is a complex system. So I think some basic understanding and knowledge of that, but some use of resources, I think that if they're not provided by the clinical institution, that then folks like ourselves and other philanthropic endeavors can hopefully get people connected to navigators, because it's a difficult system to understand.
Yes, it is. Anyone else that want to comment on this? Go ahead.
Now, I was just going to say, definitely not an area of expertise, you know, in my world, but, you know, just like Carmen mentioned, just education and learning. You mentioned your mother being a teacher. You know, I was a high school teacher for 9-10 years before coming into pharmaceuticals. So my perspective and my understanding of those two different worlds definitely changed. Being a field sales representative and now coming into the commercial learning department, again, you know, a whole different area. So it's all about learning, education, and, you know, just really understanding. But the beauty of all of this is that there are people just like us here that are wanting to educate our community, our patients. And that's a goal that I think a lot of companies have, you know, whether it's pharmaceutical, whether it's healthcare, whether it's the doctors, you know, educators. So things are in place. We need to continue moving forward to educate our patients just in the different aspects of the healthcare world, because it can be overwhelming, and just letting them know that there are people out there that are wanting to help, and connecting them to those resources is important.
All right. Absolutely. In fact, I'll use this platform to take a swing at some entities in the healthcare system. And, you know, fortunately, they're not represented here, so I have to be fair. But for many years, I remember as part of the public, not part of the healthcare system, pharma got a bad rap. It was always about the price of the medication and why it was so expensive. Well, I want them to know through this venue that, you're not the bad guys at all. It is expensive to produce a medication. You're doing many things other than just, putting the medication on the market. Like I mentioned before, the idea of giving discount to patients who don't have insurance, doing it in a bilingual and bicultural fashion, that's important. So it is the health plans that we have an issue with, and at some point, hopefully we'll call them to the mat and take care of that, because it is getting out of hand, and it's really getting frustrating. I have a patient the other day who has $100 copay per doctor per visit. Think about that for a second. $100 copay per doctor per visit. So they see me twice this week and see Dr. Vega twice next week. That's $400 out of their pocket. It's unbelievable. But again, I'm venting my frustration, and I'm going to stop doing that right now. However, the word collaboration was mentioned before, and I want to dive back into that because many entities are represented among the public that is watching us. And I want to talk about the importance of collaborating with external partners. I mean, there's many tentacles in the healthcare system. There's the pharma, there's the medical associations, there's the patient advocacy groups, there's the clinicians, there's the community groups. So we all have to deal with healthcare for people. And some people might not understand how important it is that we collaborate with each other. So can I get a comment from each one of you to corroborate on that importance? Carmen?
Sure. Well, we first of all, I want to say that collaboration with patients and patient advocacy groups is one of the most important things I think that we need to do. No matter if you're pharma or a hospital or any other part of the healthcare system, I think we have to understand the patient needs, and we have to hear where we may be missing. And so at Merck, for example, we have a chief patient officer, but we also have a group that works very closely with patient advocate organizations. And in areas where they may not have established patient advocates, we help small organizations get started and understand what it means to be a patient advocate and how to create an organizational structure that can help them do that. So I want to say that I think is probably at the top of my list. We have on our commercial side of the organization folks who work very closely with healthcare providers and insurers to try to understand and what some of their challenges are and how we can help facilitate some of those hopefully resolutions to some of those challenges. But I think, and I've said this before and I'll say it again, I in my view, some of our most important partners and stakeholders are those that do what we cannot do, meaning those that have an understanding of communities on the ground, that can help translate the messages that we want to deliver into real world interventions that make sense to various diverse communities. So I think how we work and understand what the needs are of those organizations is really critical. And we have a number of those partnerships in place, and we work with them. It's a big part of what we do in my small organization inside the company. But this is really important, and because I sit in New Jersey, I don't understand all the needs of all the various communities, which are different across all the states in this country. And we have to work with partners who can help us understand that and design those programs to be helpful and to get the patient voices.
Thank you, Carmen. Turns out that we have quite a few questions. So I'm going to use the rest of the time to try to answer those questions. I'm going to refer to Joe Lemmerman. Joe, can you address the questions that we have for the panelists?
Would love to. So first of all, if people do have questions, you can submit them through the Q&A feature as a reminder. We do have a couple questions. I'm going to start with a comment, actually. So on the topic of insurance, one of our attendees, Juan Valencia, he sent a message in that Penny is the official health insurance marketplace in Pennsylvania that's established under the ACA, the Affordable Care Act. So that exchange enables individuals to purchase private health insurance at federally subsidized rates, and 9 out of 10 individuals will qualify for financial assistance. So some really great information there. Juan, thank you so much for sharing that. First question directed to Dr. Vega. So thank you, Dr. Vega, and all the panelists. Fantastic discussion. As a patient, it is hard to find Spanish-speaking physicians and specialists. What does Temple do to help ensure that more physicians and nurses are representative of the communities that they serve?
You're absolutely right. Thank you for that question. So at Temple, I've been here for 18 years. I've seen an effort to recruit more faculty that are Spanish speakers. I try to do the same thing. I think we all do. We have a group of physicians of underrepresented minorities, and we try to do that. We try to really, expand the workforce when it comes to Spanish speakers. I can tell you that in my practice, maybe 75% to 80% of the patients are Spanish speaking only. And then I have the grandma and I have the neighbor, and everybody just comes because it's word of mouth. So I think Temple is trying, and I've seen that throughout the years. And myself as a Latina, I try to do that, just to recruit more Hispanics and more minorities into our workforce, because I think it's key if you want to provide high quality of care to your patients.
Actually, I'll add a comment on that. And Temple has done a lot for the Hispanic community. About 25 years ago or so, I was in a meeting and folks from Temple came to the Hispanic community asking what could they do to make things better for healthcare in the Hispanic community. And out of my mouth came, you should have a wing at the hospital dedicated to Hispanics, where all the docs are Hispanics, all the nurses are Hispanics. It just flew out of my mind. Would you know they did it? And for a couple of years, Temple had an actual wing at the hospital that was the Hispanic wing. It was amazing. Now,
we still have it, Dr. Collazo. We have it.
You still have it?
Yeah, we have it. Yeah, so we have a floor where everybody speaks Spanish. I think it just facilitates the care, and patients really respond to that. So unfortunately, we only have one floor. We probably need 3 floors because most of our patients, the majority of our patients are actually Hispanics. So it's a work in progress, but we do have 1 floor at least dedicated to Hispanic.
And point on that, education starts with ourselves. I mean, we are individuals who are making changes out there to make it better for Hispanics, but the word might not get to the Hispanic patient, soon enough. So we need to do a better job in collaborating with ourselves and with other groups, so that we can get an idea as to what's available out there, and we can refer the patient, so on. Many times I get a question. In fact, now that I know Dr. Vega, I know what she does, and she's been around for 18 years. I've been around for 35 years. It's embarrassing that now I get to know who she is and where she's at. So when a patient comes in, now I know who to refer to. So we are historical in nature in what we do in the Hispanic community. We are firsts, and we are going through a learning process and a collaboration process. And ideas like this one from ALPFA to put us together in venues like this is what needs to happen. Is the way I see it. Well, having said that, I'm going to refer to Adria Cordova, who's the past president of ALPFA in Philadelphia, for some closing remarks. Adria?
Hi, everyone. Can you hear me okay?
Hello, hello, yes.
Hi.
Okay, hello.
Hi, can you hear me okay? Great.
Yes.
Wow, that was amazing. Thank you all for sharing your insights and thought leadership. On behalf of ALPFA, we'd like to thank you all for joining us in this important conversation today. We hope you found this session valuable, and if you would like to share the info discussed today with others, we will be sharing the recording via email and via our newsletter. Thank you to our panelists for sharing your time and insights with all of us. We appreciate your thought leadership and are grateful for all of the important work that you do for our community. To our corporate partners, especially AstraZeneca and Merck, we thank you for your continued support and look forward to continuing our partnership with you all. I'd also like to mention to our attendees today that our partners are always looking to hire diverse talent. So if you are interested in career opportunities with AstraZeneca and Merck, please reach out to our chapter leaders and we will connect you directly to a recruiter. To the organizing team, thank you for all the work that you put into planning this wonderful event. For those that are interested in becoming an ALPFA member or joining the team, please reach out. Either go to alpha.org and find our chapter or reach out via social media, email to one of our local leaders, and we would love to have you join our team. The more the merrier, as we always say. And to everyone, I hope you found this conversation valuable. It's important that we come together to have conversations like this. Thank you all again. We look forward to seeing you at our future events. We have a few coming up this month as well as next month. Please follow us on all of our social media channels, register to become a member, and we hope to see you soon. Thank you.
Thank you all. Have a great evening.
Thank you.
Thank you.